Welcome to our SMLE Prometric MCQs 2025 series. In today's session, we will dive into high-yield cardiology questions, including coronary artery disease, heart failure, and atrial fibrillation. Exactly the kind of cases you will see on the exam day. Stay tuned till the end because I will share not just the correct answer but also key rational and exam tips that can help you boost your SMLE score. So let's move to the topic we will cover in this videos. These are coronary artery disease. There will be 5 questions related to this topic. 3 questions will be related to heart failure. 3 questions will be related to atrial fibrillation. 3 questions will be related to cardiovascular risk reduction. And 3 questions will be related to valvular disease. And finally, we will give you 3 more questions which will be related to coronary artery disease. So let's move to the first question of this video. What I will tell you, I will also share some good tips with you, so you will be able to pass your exam, and these tips are very important to follow. I will tell to everyone, just read the question carefully. Okay, highlight the keyword in the question and then read each option correct. Each option, I mean the multiple choice option. Highlight the keyword in each option. Compare those keywords with your question, and then decide. Use your theoretical knowledge, your practical knowledge, and decide which is the best option. Use this formula. Believe me, you will get the result on the exam day. So the first question of this vlog is, this is question number 1. Which of the following is the most common cause of myocardial infarction? Option A, coronary artery embolism. Option B, atherosclerotic plaque rupture. Option C, coronary vasospasm. Option D, myocarditis. I will give you 5 seconds. You can just read out and decide which is the best option. So if your option is option B, so option B I will say is the correct answer. And what is option B? Why we will go and choose option B? Because atherosclerotic plaque rupture, the majority of myocardial infarctions are caused by rupture of atherosclerotic plaque leading to thrombus formation and occlusion of coronary artery. Let's move to the second question of this most important vlog, which is question number 2. Question number 2 is, a 55-year-old man present with exertional chest pain relieved by rest. Which test is most appropriate for initial diagnosis? Option A, echocardiography. Option B, coronary angiography. Option C, exercise stress test. And option D is CT scan of the chest. Read all 4 options carefully. Decide which is the correct option. Now I give you 5 seconds. 5-second pause, and then we will come to you. And if you go for option C, so I would say that is the correct option. Rational is why exercise stress test is the correct option, because exertional angina relieved by rest suggests stable angina. Exercise stress testing is the first line diagnostic tool to evaluate ischemia in patients with intermediate risk. Let's move to question number 3 of this vlog. Question number 3 is which medication is indicated for all patients with coronary artery disease unless contraindicated? This question is related to medication. In question, option A is aspirin, option B is nifedipine, option C is digoxin, and option D is pyrazinamide. Choose the correct answer. I'll give you again 5 seconds, and if you want to go for option A, so I agree with you, and option A is the correct answer, aspirin. Rational antiplatelet therapy. Aspirin is recommended for secondary prevention in all patients with coronary artery disease to reduce the risk of MI and death. Let's move to the next question, and the next topic is related to the next topic, which is heart failure. And the question is question 4, which of the following is a hallmark of left-sided heart failure? Option A, peripheral edema, option B, hepatomegaly, option C is pulmonary congestion, option D is jugular venous distension. So the keyword in the question is left-sided heart failure. The hallmark for left-sided heart failure. There is right side and left side. Read both topic, and if you will go to option C, so option C is the correct option. Rational is pulmonary congestion is option C. The rational is left-sided heart failure leads to increased pulmonary venous pressure, resulting in pulmonary congestion, dyspnea, and orthopnea. Let's move to the fifth question of this vlog. Total question will be 20. These questions are related to cardiology. These different topic which I already explained you in the beginning. If you will read this question carefully, I am sure that this question will help you for your SMLE, which is stand for Saudi Medical Licensing Exam. And fifth question is which drug class has been shown to improve survival in heart failure with reduced ejection fraction? Option A is loop diuretic, option B beta blocker, option C nitrate, option D is calcium channel blocker. I will pause for 5 seconds. You select the correct answer, and let's see you are able to answer this question. If you want to go for option B, so well done, you are doing great job, and option B is the correct answer. Why option B is the correct answer? Let's go to the rational. Beta blocker. Rational is beta blocker. Example: carvedilol, metoprolol improve survival and reduce hospitalization in heart failure. In addition to AC inhibitor or ARNI therapy. So let's move to the next question of the same topic. Question is a 70-year-old patient has fatigue, peripheral edema, and elevated jugular venous pressure. Echocardiography shows reduced ejection fraction EF. What type of heart failure is this? Again, related to the heart failure, and they give you already the scenarios, some symptoms, and now they ask you there are different types of heart failure. Either it's option A, heart failure with like REF systolic one, heart failure if EF diastolic one, the right side heart failure only, option C, or option D is the high output heart failure. I'll pause the question for the video for 5 seconds. Will give you to choose the correct option. If you want to go to select option A, so definitely you are on the right path, and option A is the correct answer. Also leave your score in the comment section until now, that how many you answer correctly out of 6. If you are giving, if your answers 4 out of 6, so I mean you are on the right track. If 6 out of 6, you are on the outstanding, and even if 5 out of 6, so that's mean that you are quite well in this section of cardiology, which is one of the most important topic related to the exam of SMLE, Saudi Medical Licensing Exam. So option A is a heart failure or EF systolic, reduced ejection fraction less than 40% indicates systolic heart failure and commonly associated with fatigue, edema, and elevated jugular vein pressure. JVP is a jugular vein pressure. Let's move to a series of, question number 7 in the new topic, which is atrial fibrillation. All these questions you will see now related to atrial fibrillation. So, question number 7, what is the most common cause of atrial fibrillation in adult? Option A, hypertension. Option B, myocarditis. Option C, thyrotoxicosis. Option D, mitral stenosis. We pause the video for 5 seconds, select your best option, and we will compare that with the correct answer. So if you want to go for option A, which is hypertension, so your answer is 100% correct. Why option A is the correct answer? Because chronic hypertension lead to atrial remodeling and dilation, make it is the most common cause of atrial fibrillation. Let's move to the second question related to the atrial fibrillation, which is which score system is used to assess stroke in stroke risk in atrial fibrillation? Option A, CHA2 DS2 slash VASC. Option B is Premingum risk score. Option C is will score, and option D is time score. I would say to you, find these, this acronym, and this way it will also help you if you will get any question related to these type of acronym, you will be able to understand well. So what is your option? If you are going for option A, so your answer is correct. Option A is the correct answer. And why? Because this CHA2DS2VAC-SC score help determine thrombolic risk in atrial fibrillation and reduce and guides anticoagulation therapy. Let's move to the next question of related to atrial fibrillation, which is which of the following is the first line for rate control in atrial fibrillation with the rapid ventricular response? Option A is digoxin, option B is beta blocker, option C is amiodarone, option D is warfarin. We'll pause the video for 5 seconds, select your best option. We will compare that with the correct answer. So the correct answer is option B is beta blocker. Option B, why beta blocker is the correct option? Because beta blocker are the first line for controlling VF, ventricular fibrillation. Digoxin is less effective during exertion. Amiodarone is usually reversed for rhythm control. Well done. Now let's move to the new topic. In this new topic is cardiovascular risk reduction. You will find now question related to cardiovascular risk reduction. Question number 10. Which lifestyle intervention most effectively reduce cardiovascular risk? Option A, increase salt intake. Option B, Regular aerobic exercise. Option C, avoiding fruits and vegetables. Option D is a high saturated fat diet. We'll pause the video for 5 seconds. You choose your correct answer. You will compare that with the correct answer. And if you want to go and select option B, so option B is the correct option. And why option B is the correct option? Because regular aerobic exercise improve lipid profile, blood pressure, insulin sensitivity, and overall cardiovascular health. Let's move to the next question. In this next question is target LDL cholesterol per high risk cardiovascular patient is option A less than 100 milligram per deciliter, option B less than 70 milligram per deciliter, option C less than 130 milligram per deciliter, option D is less than 160 milligram per deciliter. We'll pause the video for 5 seconds, select your best option, and if you are going to select option B, so you are again on the right path, on the right direction. Option B is less than 70 milligram per deciliter. Please share your score until now in 11 questions. How many you corrected? If your target score is between 8 to 11, I would say safely you will be able to pass the Saudi medical licensing exam and you will not struggle. So this is the best way to prepare yourself for the upcoming Prometric Saudi medical licensing exam. And we are here to help you with your preparation. I'm sure that if you will watch on this question will definitely help you for your upcoming Prometric exam. Now let's move to the question number 12. Which medication is recommended for primary prevention in patients with high ASCVD risk? This is option A is statin, option B loop diuretic, option C AC inhibitors, option D is nitrate. Pause the video for 5 seconds, read carefully, select your best option and will compare to the correct option. And if you want to go for option A, so 100% your question is right. Why option A is the correct answer? Because rationale is statin lower LDL cholesterol and reduce the risk for first-time cardiovascular event in high-risk patient. Now let's move to question number 13. From onward now, this question will be related to valvular heart disease, which is another topic, most important topic. I would say to you, read about valvular heart disease and will understand this topic. And when you will understand and read in the book and then you come to the answer this question, definitely your passing your ratio will be high. So question number 13 is the most common cause of mitral stenosis worldwide is option A rheumatic heart disease, option B degenerative calcification, option C infective endocarditis, and option D is connective tissue disease. Take 5 second pause, select the correct answer and compare your answer with the answer we will provide to you, which is definitely the correct answer. So if you want to go to select option A, so your answer is 100% right. This is option A is rheumatic heart disease. Rheumatic heart disease is considered the most common cause of mitral stenosis worldwide. Why? The rationale is rheumatic fever causes comminutional fusion of the mitral valve leading to stenosis. Let's move to question number 14, which is which valve is most commonly affected in ineffective endocarditis? Option A mitral, option B tricuspid, option C aortic, option D pulmonary. Take your time, 5-second pause, select the best option, and if you want to go for option A again, option A is the correct option, which is mitral valve. Why this is the correct option? Again, here is the rationale. In left-sided infective endocarditis, the mitral valve is the most frequently involved, especially in non-IV drug user. Let's move to the question number 15 of this vlog. Most important question, and I would say if you will answer this, definitely that will be the great way for your preparation of Saudi medical licensing exam. Question number 15 is a patient with aortic stenosis present with syncope, angina, and dyspnea. What is the definitive treatment? What is the treatment? Keyword. Option A beta blocker, option B balloon valvuloplasty, option C aortic valve replacement, option D is ACE inhibitor. Pause the video for 5 seconds and will tell you select the best option. If you want to go and select option C, so option C is the correct option. Well done, and you are doing very well. I'm interested to know about your score until now. If your score in 15 questions, like between 12 and 15, so you are on the right way. In this way, you will be able to pass your Saudi medical licensing exam easily. So option C, the rationale is aortic valve replacement. Rational severe symptoms. Aortic stenosis requires valve replacement to improve survivals and symptoms. Let's move to question number 16, and we are enter now to the new topic. This new topic is related to coronary artery disease. So, which of the following biomarker rises first after myocardial infarction? Option A CKMB, option B troponin 1, option C myoglobin, and option D is LDH. Very common, and I'm sure that you will 100% select the correct answer for this question. And if you are going to select option C, so option C is the right answer, which is myoglobin. Myoglobin rises within 1 to 3 hours post MI early than CKMB and troponin, but it is less specific. Let's move to question number 17 of this vlog. And question number 17 is which of the following is considered a non-modified risk factor for coronary artery disease? Which one is considered? Option A is smoking, B is diabetes, C is age, D is hypertension. One is non-modifiable risk factor, one is modifiable risk factor. Read out about these, and I'm sure if you will read about these, you will definitely understand about this topic. So if you are going to select option C, so your answer is 100% correct, which is age, and the rationale is option C. Sorry, this is option C. Age, sex, and family histories are non-modifiable risk factor for coronary artery disease, while smoking, diabetes, and hypertension are modifiable risk factor. Let's move to the next question of this video, which is Question number 18. Which of the following medication improve mortality in post-MI patient? Option A, aspirin. Option B, morphine. Option C, nitrate. And option D, calcium channel blocker. I'll pause the video for 5 seconds and I will ask you to select your best option. If you are going to select option A, so you are 100% right. Option A is the correct option. Then there is aspirin. Antiplatelet therapy reduce recurrent MI and mortality in post-MI patient. Let's move to question 19. We are nearly to the closing of this session. Question number 19 is which ECG changes is most specific for acute inferior MI? Option A, ST elevation in lead 2, 3 and AVF. Option B, ST elevation in leads 4, lead 6 and V4, lead 4, and option C is ST depression in lead 1 and AVL. Option D is T wave inversion in V5 and V6. We'll pause the video for 5 seconds. You choose your best answer and let's compare your choice with the correct answer. If you want to go to select option A, so 100% your option is correct, your selection is right. ST elevation in lead 2, 3 AVF shows leads to ST elevation in these inferior leads indicate acute inferior wall myocardial infarction. The last question of this video, I'm sure that if everyone will answer this question correctly. Question number 20. Which of the following is part of secondary intervention after ACS, acute coronary syndrome? Option A, statin. Option B, ACE inhibitor. Option C, beta blocker. Option D, all of the above. Which is the correct one? We'll pause the video for 5 seconds. You select your best choice and we will compare that over correct option. And correct option, if you want to go for option D is the correct option. And why option D is the correct option? Because let's move to the rational. This is option D and we will go to rational. Rational is secondary prevention after acute coronary syndrome include statin, ACE inhibitor or ARBs, beta blocker, antiplatelets therapy and lifestyle modification. So that's the end of this most important vlog. I'm sure that you enjoyed this vlog and you would. I'm also, if you enjoyed this SMLE practice session, make sure to subscribe and watch part 2. Soon we will give you another part related to another area of the exam. In this way, it will help your preparation for the upcoming SMLE Saudi Medical Licensing Exam preparation, and we will continue with more Prometric style MCQs and high yield explanation. So I would say to you, your every like and comments helps this series reach more doctors preparing just like you. So if you like and subscribe our channel, it gives us motivation to produce more video for you, and the main aim is that you can pass your SMLE Saudi Medical Licensing Exam. I would say thank you so much for watching this video, and will just tell you that Dubai Healthcare Consultancy is the best platform to assist doctor, nurses and allied healthcare professionals for the health authority registration, data flow verification and license exam booking. So if your aim is to to find a job in Dubai, Saudi Arabia, Oman, Bahrain, Qatar, and Kuwait. So I would say Dubai Healthcare Consultancy is the best platform to assist you for your health authority registration, data flow verification, and license exam booking. We assisted many of the candidates, more than 300 candidates for different Gulf licensing exam. So if you are struggle with one of these process, contact to us. We will start your registration process. We will also give you the exam material, and these exam material will definitely help you to pass your exam. And I hope this video you really enjoyed. So you can just contact us. Our contact number is on your screen. You can contact us and our team will definitely assist you for this whole registration process. Thank you so much for watching this video, and if you have any comments, if you want me to ask anything related to your SMLE exam preparation, so I would say leave in the comment section. I will answer all your queries in the upcoming video. Thank you so much and have a nice day.